My doctoral thesis dealt with earthquake casualty assessment. Basically, what I did is took a traditional model, an American model actually. It's a very traditional engineering-based model that deals with assessing casualties according to physical damage to structures. And I tried to integrate into this model human-related factors, social factors, epidemiological risk factors, in order to create a holistic and a comprehensive assessment model that will reflect better the number of casualties expected from an earthquake scenario that may strike Israel. So this is my first research interest, and the project I'm dealing with right now is more of a earthquake response project. It deals with improving response capacity and maintaining continuity of care to vulnerable populations, mainly frail elderly, chronically ill, and so on. So the findings from my doctoral thesis actually changed the way that Israel is performing earthquake scenarios when we're doing earthquake preparedness simulations. So now we use different casualty rates because one of the findings were that we used an American model, American-based model. And one of the findings were that the casualty rates used here are not suitable for use in Israel because the housing is different, the population is different. So we kind of updated the rates that we are using. And now when we are performing earthquake scenarios and simulations to try and assess the potential outcomes and damages, we use a much more updated and suitable rates specifically for the Israeli scenario. So this is that. And the other research, the more earthquake response research, is still an ongoing research. But I'm hoping that it will enable to help maintain continuity of care for vulnerable populations following an earthquake. And by that, I'm not sure if eliminate, but maybe to reduce adverse health outcomes for these populations. Well, in terms of earthquake, in Israel, we didn't have an earthquake in the last 90 years. The last one was in 1927, so I can't say much about earthquake health outcomes in Israel, but if we look at the outcomes in the world, we see a lot of physical adverse health outcomes and mental adverse health outcomes. We're talking about higher rates of PTSD and mental illness among vulnerable populations. If we're talking about chronically ill patients, we're talking about exacerbation of their morbidity, additional morbidity, higher rates of respiratory disease, illness, and so on. So many. So, yeah, we have a lot to work on. Well, first of all, some of the scenarios are the same if we're talking about not only natural disasters like earthquake, but man-made disaster, technological disasters. So we're facing sometimes the same scenarios and same challenges. But I think the best similarity I can think of is the challenge of making the population, engaging them with preparedness measures, how to make them, how to promote them doing or taking preparedness measures, because it's a really big challenge. People don't usually are very happy or very trying to take by themselves preparedness measures. It's always like step to the side, and we dealing with their routine lives and not thinking about emergencies or disasters about to happen. So I think making the population more prepared, better prepared for emergencies is a challenge that is come to every country all over the world. The most obvious difference is the size. I mean, the US is enormous compared with Israel. So I think in Israel it's really, I I won't say easier, but it's simpler to create a national preparedness system because everything is within reach. All the organizations, the people, most of the people know each other, the people who are dealing with emergency preparedness in the US, because of the federal structures and the size of the states, it's a little bit more difficult to create something like a whole net of complete net of emergency of a preparedness system. But on the other hand, if someone, let's say a disaster strikes the West Coast, the people in the East Coast are not impacted, maybe, okay, it depends on the disaster, of course, but are maybe not impacted at all. So you have a lot of supplies and a lot of resources that can be taken from this place to the disaster situation. So this is something that we don't have in Israel because of the small size of the country. If something happens, usually the entire place is affected. So chaos is all over the place. It's a little bit difficult to manage an emergency situation like that, but yeah, we have a lot of experience in emergencies, so we're trying to deal with it. I can say this. In Israel, the very common scenario is man-made disaster. We have a lot of armed conflicts, as you all probably know, between Israel and Gaza. The last one was at 2014, Operation Protective Edge. So we have a lot of experience in this kind of scenarios. And you can say an all-hazard approach, so this kind of experience can be translated to other scenarios, but I actually think that's not exactly accurate. I mean, each scenario has its own features and its own characteristics, and you have to be prepared for all of the scenarios. Like, the scenario of an earthquake is definitely possible in Israel. We are very close to an active fault line. It can happen every day, but most of the resources are allocated towards the man-made scenarios, the armed conflict scenarios. So this is a problem, I think, that we should, in Israel, we should address more. We have to allocate a little bit more resources to prepare for other scenarios. This is one of the problems we have, to my opinion. Along with allocating resources to all of the scenarios possible in Israel, we have to focus on enhancing our response capacity to vulnerable populations. This is the study I'm doing right now. There is a new approach in the health system in Israel. It's called the patient-focused approach. But I still feel that if you examine the situation in the health system in Israel and other organizations that are supposed to care for people following disasters, we still have a lot to improve. A lot of information sharing processes has to be made. The interface between organizations and people who are dealing with emergency response are still not optimal. We still have to refine these exact points. I mean, each organization has a very good contingency plans in case of an emergency, but when you look at the interface between these organizations, still we have work to do. And this is exactly the place I think we have to look at and research and try to implement changes.